The treatment of schizophrenia is a complex challenge, and I think there are a lot of unmet needs. So we have a number of patients who don't respond adequately to the treatments that we have. In addition, we have a large proportion of our patients who have difficulty adhering to the medication that we prescribe. So there are a lot of relapses and hospitalizations that occur, which we could avoid. In addition, there are many patients who still have difficulty functioning in terms of psychosocial and vocational abilities and functioning. And so we need to do more in terms of helping people get back to work or back to school or being a homemaker or whatever it is that they choose to do. Many of our patients still need a lot of help in achieving those goals. The challenges in treating schizophrenia are really multifold. I mean, first, when the illness begins, it's usually in late adolescence or early adulthood. And at that point, the individual who's affected can have difficulty really recognizing that something's wrong and accepting the need for treatment. So one of our challenges is a very long duration of untreated illness or untreated psychosis. And we need to do a much better job of engaging people earlier in treatment, helping them to identify that something's wrong, or helping their families to identify that there's a problem and knowing what to do about it. And it can be quite confusing. And also in the early stages of illness, people often don't have insight. So they may be experiencing psychotic signs and symptoms such as delusions or hallucinations, but not really recognizing that these are irrational or illogical, and therefore they don't always see the need for immediate help. That's a big challenge for us. And then even once we do get someone to accept the need for treatment and engage in treatment, it can be difficult to sustain that engagement, because if they're feeling better, they may drop out of treatment and think that it's no longer necessary. So, those are some of our biggest challenges. And in some cases, the better that someone is doing, the less likely they are to see the need for continued treatment. So they stop the treatment and then they end up getting sick again. So sometimes we get into this vicious cycle of improvement and then relapse and deterioration, and then we try to bring about improvement. And it's not always easy to get back to where you were before.